Hi, I'm Malcolm Root. I'm a board-certified plastic surgeon here in College Station. I've been in College Station about 13 years. I'm class of '93, so my wife and I, Stacy, wanted to get back here to raise our family after I got out of residency. Here we specialize in breast augmentation and body contouring surgeries, particularly body tight and face tight, which is a new addition to our practice. Probably one of the most important things that we emphasize to everyone who works here, the first thing that we talk about is how do we take care of our patients. If you take care of your patients well, almost everything else takes care of itself. There's a lot to make me proud about being a plastic surgeon. We get to help people on a very regular basis, and that in terms of job satisfaction, I really can't imagine too many jobs having a higher satisfaction. And that's true whether it's a breast reconstruction who you're kind of helping her regain her form, or maybe even better form, or some of the contouring after weight loss surgery. I can think of innumerable patients that have lost maybe a whole nother person, shall we say, in the amount of weight, and they look in the mirror and they still see their former selves until we get rid of all the extra skin and get them back into the shape that they really feel like now. It's not that they see it, but how to get them to look how they feel. I usually talk to patients about sort of the idea of a toolbox, that we want to have as many tools in the toolbox as possible, which is nice. If you're going to see a board-certified plastic surgeon, presumably they're going to have the most tools in the toolbox to offer you. There's a phrase that if all you have is a hammer, the whole world is a nail, and you want to see a surgeon that has the ability to offer you different things based on what you need. When choosing a plastic surgeon, I usually tell people one of the most important things that you have to have with your plastic surgeon is actually communication. I often tell the patients, I can do a lot of things, and if I know what you want, I've got a much better chance of giving it to you than if you and I are on different pages. So it's very important to communicate with your plastic surgeon, and after you talk to a plastic surgeon, an important question to ask yourself is, was I communicating with that person very well? Usually if patients come in for a consultation, depending on the consultation, it's a little different, but for instance, for breast augmentation or face tight or body tight, we actually block aside an hour so that we can really get to know the patient, take them through some before and afters, explain the procedure, and then examine them and say, okay, with the information that you have in terms of what can this procedure provide and do, and what can the procedure not do? What are its limitations? How does that apply to you? And then we can talk about that, and so that you as the patient will have a realistic expectation of what you can get and what you can benefit from the surgery. We're very happy with our practice. We have a great group of staff that have been with us a number of years, and they really help us all take great care of our patients. And the community's been very good to us, so we're very grateful to live in this community and get to help it out as it's helped us. Thank you for spending some time with Brazos Valley Plastic Surgery. We'd really like to get to meet you and get a chance to take care of you.